6:32, the Centers for Disease Control and Prevention, they say the flu season this year into next year could be an especially rough one.
But like many sicknesses and illnesses, there are ways to prevent yourself from getting sick, especially with the flu this year. This morning, our Megan Selensky is joining us live from LECOM Center for Health and Aging with more on how to prevent yourself from getting sick. Good morning, Megan.
Mark, Brissa, good morning. Starting at 9 o'clock today, they will start their flu clinic here at the LECOM Center for Health and Aging. It runs Monday to Friday, 9 to 5, and you might see some boxes like this, but this isn't the only thing that they will be offering here at the clinic starting today. The LECOM Center for Health and Aging is a one-stop shop. Not only are they offering the flu shots this year, but COVID vaccines as well. And in conjunction with the Erie County Health Department, LECOM is now also running a drive-through testing center here at the LECOM Center for Health and Aging to screen for both flu and COVID-19. Here at the clinic, they are able to get you seen by a physician as well as prepare and administer antibiotics. Vaccine coordinator Jim Caputo says that LECOM is proud to be offering such a convenient option for patients. He says they found the drive-through method effective during the height of the pandemic, and LECOM wants to do their best to be prepared for this year's flu season. Although they've prepared, LECOM still urges everyone to do their part in preventing any further spread of illnesses this fall.
One of the big things that we would ask is when we have folks in long-term care or we have folks in a school situation is be cognizant if you have something, stay home. Don't come out, and it's very nice to share, but flu and COVID and respiratory illnesses are not the best things to share.
Flu season is already here and it's expected to be brutal, so wash your hands, get your flu vaccine, and stay home if you're sick. Mark, Brissa, back to you.
All right, thanks so much, Megan. Well, joining us this morning to talk more about flu season and COVID-19 is Dr. Becky Dawson, epidemiologist. Good morning, Dr. Becky.
Good morning.
Good morning once again, Dr. Dawson. Let's talk about timing with the flu shot. It's the 17th of October. We know LECOM's been doing the clinic here for a little while now. How long does that vaccine protection last? Is it going to be enough to get us through the entire season?
Well, that's a great question. And the answer is it's about 6 months. So right now is sort of your sweet spot, your perfect window to get that influenza vaccine so that you protect yourself from early flu, but also that you'll have immunity to get you through the entire flu season. So this week through basically election day are the best 3 weeks of the season to get that influenza vaccine. So go do it now.
And Dr. Becky, going out and about, going to the grocery store, you see more and more people now starting to bring back their face masks. Is this something that you think everyone should start doing?
I don't think we're at the point now where everyone needs to be wearing their face masks. I think that there are occasions where you should be wearing your face mask. So number one, if you have any symptoms, just a sore throat, just a headache, just a runny nose, stick your mask on to protect other people, to keep people from getting sick. If you are going to visit someone, live with someone, or you yourself are, potentially at more risk, it probably is wise to stick your mask on in crowded indoor spaces. But I don't think we're at a place where everyone needs to be masking just yet.
Dr. Dawson, we heard Megan mention that LECOM's offering up the flu vaccine and that COVID booster shot at the same time. Some folks out there may be thinking, hey, the pandemic's winding down. I don't need that booster. What would you say to anybody heading out for that flu shot, but maybe not considering the COVID booster?
So I would really encourage people to get that bivalent booster. And the reason that the bivalent booster is so important is that we are expecting an uptick in cases, and we have new subvariants that are entering the United States and starting to cause more disease. So each week we're seeing, new cases being caused by different variants. And as I mentioned before, some of these new variants are avoiding or not able to be treated by some of the treatments that we have available to us, but the vaccines are doing an amazing job of preventing severe disease and illness. So it's really crucial that you get that booster shot and that you start the primary series if you haven't been boosted or you haven't been vaccinated at this point in time yet.
Epidemiologist and Erie News Now contributor Dr. Becky Dawson. Dr. Becky, we always appreciate you joining us so early.